Daniel Hill, and this is Specialist Pomerello. He's helped me do my health assessment today. Starting with level of consciousness, what's your first name?
Joseph.
Where are you right now?
The unit. In Somersworth.
Okay. And why are you here today?
I'm experiencing pain somewhere.
Okay, great. I would also use the mini mental status tool as well to evaluate their level of consciousness. I start evaluating my patient from head to toe. I'm going to start with the temporal mandibular joint. All right, go ahead. I'm going to observe and palpate at the same time, so go ahead and open your mouth. All right, close it. Move it side to side. All right, articulate it out. All right, move it out and then move it in. Great. I'm going to evaluate cranial nerve number 1, the olfactory nerve. Can you block one nostril for me and tell me what this smells like?
Black cherry.
All right, block the other nostril. What does it smell like?
Black cherry.
Great. I am going to test the cranial nerve number 2, or the optic nerve. Normally I'd use a Snellen chart for distance to test his vision, and then I would use a piece of fine print, perhaps a newspaper or what I have here, about 14 inches away, and can you read that top line for me?
Nursing 310 health assessment.
I'm going to assess cranial nerves number 3, 4, and 6. I'm going to assess his pupillary movement by checking for direct and consensual movement. So what I'll end up doing is shining my light in his eye like this, just look across the room, and I'm going to watch pupillary movement. All right, so upon direct, we had movement, and then consensual, I'll be watching this eye, and they both moved, and I'll check both eyes for that. Now I'm going to check for accommodation, so continue to look across the room, and when I say now, focus on my finger and watch it come in. Now, and watching his eyes smoothly track in. Now I'm going to check for peripheral vision, so cover your one eye and tell me when you see my fingers, and just say now when you see them, okay?
Mm-hmm. Now. Now.
Okay.
Now. Now. Now.
All right, great, good job. And then I would test both eyes as well. I'm going to test cranial nerve number 5, the trigeminal nerve, okay? And I'll do that by first palpating the jaw, and all you have to do is clench your jaw for me, and I'm going to feel the muscles clench, and I feel the muscles move. Okay, clench one more time, and I feel the muscle move there. All right, what I'm going to do is give you the sharp, dull test, all right? So I'm going to touch you with that. You tell me this is dull, and this would be the sharp side as well, okay?
Yep.
All right, so I'm going to touch those same areas on both sides of the face. You just tell me the difference if it's sharp or dull, okay?
Dull. Sharp. Dull. Sharp.
Good. I'm going to test cranial nerve number 7, which is the facial nerve. And can you just raise your eyebrows for me? Give me a big smile, sad face. All right, good job. Can you close your eyes for me, and don't let me open your eyes, okay? Close them shut tight. Tight, like, there you go. Good. I'm going to test cranial nerve number 8, the vestibulocochlear nerve. And we're going to do that by doing the Weber test, Weber tuning fork test, the whisper test, and the Ryan tuning fork test. So starting with the whisper test, can you cover one ear? I'm going to say 3 words. You can tell me. I'm going to whisper 3 words. Can you tell me what those 3 words are?
Round ball and cat.
All right, and I also test the other side. The Weber tuning fork test. So what I do is activate it, put it on the top of his head, and you would tell me if you hear him on both ears. So you hear both ears?
Hear them.
The Rin tuning fork test. And first I would activate my tuning fork, put it on the back of his mouth. So tell me when you stop hearing this.
Stop hearing it. And it's gone.
So we're going to test cranial nerves numbers 9 and 10, which would be the glossopharyngeal and the vagus nerve. So what I would do is take my light, look inside his mouth, and observe the soft palate. Say ah. All right. Watch the soft palate move. Next part would be to test the gag reflex. So what I would do is take a tongue depressor and touch the soft palate, and then see if he has a reaction or not, to test to see if that nerve is in place. Now I'm going to test cranial nerve number 12, which is the hypoglossopial nerve. Could you please stick your tongue out for me? Perfect. Now we're going to test range of motion. So can you tilt your head forward? That'd be flexing. Lift it up. That'd be extending. Go back to neutral. Look left. Look right. All right, bring your head to your shoulder. Now the other side. Great. We're going to test strength, so lean forward. Okay, with your head back, side to side. +5 in all directions. Now I'm going to test cranial nerve number 11, the spinal accessory nerve. Can you lift your shoulders for me? Great. All right, now I'm going to assess the spinal area, so I'll look at his neck, symmetrical, no deformities, contusions, no bruising. I'm going to feel palpate his spine for a step off, nothing there. No crepitus noted. So I'm going to inspect the back, and I'll look at his shoulders, make it the same height, look at his waist, make sure they're the same height. I'm going to look at his spine, make sure it is midline. All right, I'm going to test range of motion. Can you lean forward as far as you can? All right, while he's down there, I'm going to feel his spine for crepitus, step off, any deformities, swelling, and note the skin if there's any redness or any problems. Looking down his back, I do not feel anything. Can you lean backwards for me or stand straight up? All right, so that's extension. Now let's stand back, go backwards, like that's hyperextension. Good. Now stand straight up. Put your hands at your side and try to touch your knees, left to right. So bring your left knee down like that. All right, good. Now do the other side. Great. Neutral position. Now turn your upper body to the left. Now turn to the right. Good range of motion in all directions. All right, just your upper torso, lean forward. Great. Lean back a little bit. There you go. Lean to the right. There we go. And left. Great. All right, so I'm going to look at his shoulders, make sure they're the same height, okay? We're going to do range of motion. Can you bring your arms forward and up at the same time? All right, that's flexion. Go back down to neutral position. That's extension. Now go put your arms back. That's hyperextension. Bring it to neutral. We're going to bring your arms up to the sides here. All right, bring them back down. Great. Put your hand in the small of your back like this. Now go behind your head. Great. So I'm going to do an inspection of his shoulder girdle. Make sure it's in place. It's not higher or lower. Same thing with his elbow. Look for contusions, deformities, any tenderness, rigidity, anything that's going on. Look at his wrist. Palpate all the bones that are in there. Any pain when I do that? Any pain noted? Nope. All right. Can you wiggle your fingers for me? Great. Just your fingers and your fingers alone. Can you bring your hand down? That's flexion. Extend straight, and then hyperextend. Can you do that at all? Great. Thank you. And lift your arms up again. Okay. Back down. Great. Okay. Lift your arms up like this. All right, that's flexion, go back down. That's extension. Can you hyperextend at all? No. Okay. With your hands in pronation, close your fingers. Now lift up your fingers. Great. All right, can you rotate your wrists? Awesome. All right, just your biceps, lift up. All right, push down. We're going to test the shoulders. Move your hands out. Back in. Great. Squeeze my fingers. All right. Supination, bring your hands up like this. Bring your fingers to your thumb to your pinky. Okay. Now go like this with your two okay signs. All right. Don't let me break the grip. Great. We're gonna do the valence test now. So just follow me when you do this. Put your hands back to back right here, and bring your hands down here and hold it. Try to keep the back of your hands together. All right. We're going to do this for a minute, and during this time period, if you're feeling tingling, paralysis in your thumb, index finger, middle finger, or the lateral half of your ring finger, it's an indication of carpal tunnel syndrome. A minute has gone by. Any experiencing that sensation?
Nope.
Thank you. I'm going to test reflexes. So starting with the bicep, I'm going to find the bicep tendon with my 2 fingers there. Use the small side and look for a reflex. He's got a small reflex when I do hit it. All right, going to move on to the tricep. All right. Take control of his arm, get it to dangle a little bit. Find his tricep muscle, which is located right there, and hitting with the wide side. There we go. Now we're going to do the brachial radialis reflex. All right, so feeling that tendon right there. Got a little reflex. Yeah, there we go. Good one. I'm going to do the lower extremities. So looking at his legs. They look symmetrical. I'm going to start making my way down for the palpitation. So make sure his hips are stable. I'm going to push in and pull out. I feel no crepitus. I'm going to look at his legs, go to his knees, check for stability. Right there, check his ankle for stability. And then I would look at his toes to make sure that, and his feet. Now we're going to test your range of motion. So if you could, with your left leg, just lift it as high as you can. All right. That's flexion. Go back to the neutral position. Great. Bring your leg out to the side. Great. Bring it back in. Good job. Now bring your knee to your chest. Great. Now bring your knee out to the side. All right, bring it back up. Great. I'm just going to do something real quick. Great. Good. So I'm going to check his ranges of motion. Can you lift your feet up? All right, push down. Bring your toes out to the side. Bring them inward. Bring your knee to your chest. Okay, test it for strength. Bring your leg down. Good, and I would check both legs bilaterally. Can you sit up for me? Yeah. All right. Bring your legs straight out, like the bottom half. There you go. Now lift back, go back down. Great. Now push down on your feet. Good, now lift up. Great. So I'm testing reflexes, patellar reflex. I'm going to find the tendon, and with the round side, I'm going to tap here. If they're distracted, I'll have them clench their hands. That way we get a reflex. There we go. Good. Now I'm going to check the Achilles reflex here. All right, you can relax your leg. Okay. Using the flat side. There you go. So now I'm looking for the ankle clonus or ankle clonus reflex. Okay, so what you do is support the leg, push back, release once, and let it go down smoothly. And then this time hold and let it down and feel it let down. If you have any tics or bumps or reaction, that is positive for ankle clonus. It should be smooth coming back. Do the Babinski reflex, which comes up like this. Go across the feet, and his toes did pull back for a negative Babinski. All right, go ahead and stand up. Come on over here. You're going to quickly walk down and back, all right? So now I'm going to test his motor system. I'm going to watch him walk across the room. So go ahead and walk across the room and come right back to me. I'm looking at his gait. It's steady, well balanced. I'm going to watch him do heel-toe walking. So go ahead and heel-toe. You're well balanced and coordinated. Go ahead and turn around and walk back. Your feet together and bend at your knees. All right, now stand up straight. Stand on one foot. Now stand on the other foot. All right, now hop on your foot. All right, good. Have you, in a moment, put your arms out in front of you like this with your palms up, straight up, okay, to the sky. Then you're going to close your eyes and just stand there as long as you can. So go ahead and do that. I'm going to stand by, watch him, see how his balance is, and watch his hands for that drifted down. He doesn't have that, and I'd watch this for a minute, and I also stand by to catch him if he fell or lost. Now we're going to do the Romberg test. So you're going to stand there with your eyes closed and your hands by your side, and just stand there as long as you can. And this is someone else. I test their balance. And someone, you will see a slight sway, which is normal, but if someone has an exaggerated sway or actually falls, then they'd be a positive for a Romberg test. Now I'm going to test your coordination with rapid alternating movements. So what I want you to do is I'm going to put my finger here, touch your nose, and then touch my finger, and just do it in a nice smooth motion going back and forth. So go ahead and do that now. All right. Now close your eyes and do it. Good. Open your eyes. All right. Now keep touching my finger. Good. So now I'm going to test your ability to touch your fingertips. So palms up and just alternating, going back and forth each finger, okay? There you go. Good job. Palms, okay? So what you're going to do is put your hands on your legs like this, and then quickly just go. All right? Yep. Good. Great. Good job. All right. Go ahead and stand up for me. Now what I have you do this time is take your leg, put your heel on your knee, and then run your foot down, your pants down to your feet, and then stand. Good. Now close your eyes and tell me when I touch your hands.
Touch. Touch.
Now your feet.
Touch. Touch.
So now I'm going to do the superficial pain test, okay? So superficial pain test, I'm going to ask you to tell me if you can feel the difference between sharp and dull, okay?
Mm-hmm.
So that's what sharp feels like, and that's what dull feels like, okay?
Yep.
All right, close your eyes and tell me what you feel. What he doesn't know is that I'll be testing, I'll be sharp all the time, and I'll have the needle points together, so it may feel dull to him. Do you feel
Sharp.
okay?
Sharp.
Great. And I would measure these as we're going along, and he's at 2 millimeters for both. And I would test down here on his foot as well, skin to skin.
Sharp.
Okay.
Sharp.
Great. And he's at 2 millimeters all the way around. Oh, now I'm going to test his vibration sense. So I'm going to activate this. All right. Can you feel this?
Yes.
All right. Do this down over here.
Yes.
Toes.
Yes. Yes.
And what does it feel like?
Vibrating.
All right. Close your eyes for me. I'm going to test his position sense. So tell me which direction I'm moving your finger.
Up. Down. Right. Left.
Same thing with the toes.
Up. Down. Right. Left.
Good job. Now I'm going to test superficial pain test. So this is when I'd actually do dull versus pain. All right, so tell me if you feel, what do you feel there? This is going to be the sharp, and that's going to be the dull, okay?
Mm-hmm. Dull. Sharp. Dull. Sharp. Dull. Sharp. Dull. Sharp.
Good. So now I'm going to do graphesthesia test, and I need you to close your eyes, and I'm just going to write a number on the palm of your hand. You tell me what number that is.
3.
Good job. I'd just like to thank Specialist Pomerello for his help, and thank you for your time and consideration.